Thank you, Chairwoman Eshoo. Thank you for having this hearing. I was one of the drafters of the ACA, and obviously very proud of that fact. And I do believe that the ACA could have and still can achieve almost universal coverage. I mean, the idea was that 65 some percent of the people get their insurance through the employer, and then we had this large group of people who buy insurance individually on the marketplace but can't afford it. So the idea was to try to make it affordable, and that's where the subsidies came in. And the mandate, the idea with the mandate was that, we'll give them enough of a subsidy so they'll buy insurance rather than paying a penalty to not buy it. But there were still two groups that were still out there, even with that scenario. One were those who wouldn't be able to pay a premium, and that's why we wanted to expand Medicaid. And then the last group were the uninsured. I'm sorry, not the uninsured, the undocumented, which as far as I'm concerned, we should have addressed, and we had a debate, but we couldn't get the votes. So I wanted to ask Ms. Rosenbaum, with regard to the Medicaid expansion, it was not supposed to be optional under the ACA, but the Supreme Court holding in NFIB versus Sebelius said they had a choice whether to expand or not. And if all of the states were willing to put aside this partisanship and act in the best interests of their residents, I think we'd be much closer to the goal of universal coverage. So let me quickly, because I want to get to the undocumented, can you tell us as of today how many states have expanded Medicaid?
Everybody but 14. A couple are still on the verge of phasing in, but there are 14 left.
And for those states that expanded Medicaid, they got a pretty generous deal in terms of how much of that cost is paid for by the federal government, correct?
Yes.
And Congressman Veazey's bill that we're considering today, the Incentivizing Medicaid Expansion Act, would make that offer even more generous, correct?
Yes.
So if all states were to expand Medicaid as originally intended by the ACA, how many people do you think would gain coverage that don't have it now?
We're at about 15 million now. It's roughly another 2 million people, a little more than 2 million people.
Okay. Now, do you want to, not open-ended because I want to get to the undocumented, but would you give me any sense of why you think these states are still rejecting the Medicaid expansion? Is it strictly ideology? What is it, you think?
This has been looked at a lot. I would say it's a deep philosophical opposition to the expansion. Cost certainly doesn't explain it. The federal financing doesn't explain it, even at the current rate. So I would say we're dealing with something deeper.
Ideological. All right. Now let me get to the undocumented. We know that a large portion of this country's uninsured rate comes from undocumented individuals. What would you like if we covered all the undocumented? What do you think percentage-wise that would mean?
Well, I mean, that would be universal coverage. There are proposals that are universal up to legally present immigrants, and also that address the short-term, the people who have been here for less than 5 years.
Well, let me put it this way. Let's assume that everybody who was legally here, documented, had insurance coverage. I think would be accurate to say we'd still maybe be only at 95% because there'd be another 5% that are undocumented. I mean, I know that's a huge.
Right. No, and it's not a good thing for any healthcare system to leave anybody out.
Okay, but would you agree? Even if everyone was covered who was legal, you'd probably still have another 5% of the total population that's not covered because they're undocumented.
Yes.
Okay, so. I mean, I agree with you. It doesn't make any sense. You get sick, you spread disease. I mean, what are we talking about here? It's not, you can't operate in isolation. So, those undocumented people obviously have health care needs. How do they get that care, and what cost does that add to our system? Does this make any sense? I don't think so, to not cover the undocumented in terms of the cost to our system and how we operate.
Those who are willing to come forward use isolated public health services. In extreme situations, they would turn to an emergency department, but the care is uneven, too late, and too many people live in the shadows really without any health care at all. There are no waiting lists for people who are uninsured.
But also, doesn't it just not make sense from a cost point of view? Because if those people got preventative care and were able to see a doctor, they wouldn't end up in the hospital emergency room because they wouldn't get as sick. I mean, you want to comment on that?
Absolutely, and it's very difficult to begin to quantify these kinds of shifts, but very important to bring everybody in to deal with health problems before they become serious enough to be high cost.
All right. Thank you so much. Thank you, Madam Chair.